Okay, hi everybody. Thanks for joining us at this time. So I'm going to introduce myself a little bit, if you can hear me clearly. Okay, I'm going to share, before I start introducing, I'm going to share my slides. Hang on, give me a moment. Okay. Yeah, so today we're going to talk about our the programs. Okay, so this is about the counseling and psychology for master and graduate diploma. All right, so just a brief introduction of myself. Okay, my name is Jeslyn, and I'm currently a developmental psychologist, and I'm the immediate past president of Association of Psychotherapists and Counsellors Singapore, APACS for short. Okay, so right now I'm currently doing my private practice. I founded my culture in about 2012, and recently the Thrive Psychological Clinic. Basically, the Thrive Psychology Clinic, it's mainly targeted on children and youth. Okay, so my culture is more for adults. So some of the services that we actually provide are psychotherapy, counseling, we have art therapy, animal therapy, hypnotherapy, and things like that. And we also do diagnostic assessments. Okay, and I'm also currently providing services in the community hospitals like NUH, Alexandra, Jurong Healthcare, and things like that for the staffs working there. So it's not for the public there, but rather the staff wellness. Okay, and also lecturing in some of the institution. I mean, of course, one of which is this Aventis. Okay, so yep, let's go into APACS. Okay, so Association of Psychotherapists and Counsellors Singapore, mainly the courses that they have here in Aventis are accredited by APACS. Okay, and for this Association of Psychotherapists and Counsellors Singapore, we work in a very holistic manner, meaning that you can join this association as long as, I mean, if you have interest, keen interest in working as in this helping professions. Basically, we also have, not necessary that you have to be a counselor or psychotherapist to be in this association. I mean, we have nurses, we have teachers, we even have monks, priests, anybody who are interested in this, okay, can join us. And we have different tiers of membership in this association, student members, and I'll tell you more of the different levels of the membership for APACS later on, okay? So that this is the association that accredits the courses here. All right, so what about Aventis? Aventis is established since 2007, which is about 13 years ago or so. And most of their courses are actually catered for adult learners like yourself. Like if you're busy working adults, their courses are being held in the weekends, during the weekends. So for more information about these Aventis, you can go to their website or you can check with Calvin here later on. Okay. So welcome to the world of counseling and psychology. Counseling, psychology, and psychotherapy, they are considered mental health, right? And I'm not too sure if you have noticed that this profession has actually gained a higher recognition during the recent years with our government. Not sure if you noticed that, especially during this COVID-19 situation, before that our mental health is not considered as essential services. Only I think last week they started the reclassification. And what I'm trying to say here is that that this profession is of importance. Okay, so if you go into this course, this program in counseling and psychology, psychotherapy, you can use it for life. It's not that you definitely have to use it for your career after that. You need not become a counselor, or you need not become a psychotherapist or whatsoever. It's for life. So you can use it with your family. Some of my students, they are teachers. They're not even in this field. They are engineers, they are accountants. I mean, they use it with their co-workers, children, or that's why I say it's for life. Okay, so it's not going to be wasted, okay, per se. And this graduate diploma in social psychology and counseling, it's being held in 4 weekend blocks, okay, and it's 6 months part-time. So after 6 months, and it's also for people who has little or no knowledge in terms of counseling and psychology. Basically, I can say that this is quite fundamental. Okay, it's a fundamental basis for you to start going into this industry. So what you will learn in this grad day is that the syllabus. So we have perspectives in social psychology, we have effective counseling techniques, developmental psychology, counseling and psychotherapy. So perspectives in social psychology. In social psychology, people learn how others behave around other people. Okay, in different settings, it's all about relationship, cultural differences, and how people think and relate to one another. Okay, so this is what you learn in social psychology. I mean, we are humans, we are all around people all the time. Okay, and then effective counseling techniques. So some people ask, hey, counseling, very easy, just talk and then listen and then advise. Why do we need techniques? So here, it is not simply just by listening and giving advices. In fact, in counseling, we don't give advices. Okay, we try not to give advices. And that brings you to another higher level. We learn things like empathy, awareness, observation, your body language, the posture, and how do you actually respond toward your clients and things like that. So that's a little bit more in depth into the counseling techniques. Developmental psychology talks about emotional, behavioral, and basically the cognitive aspect of individual throughout the different life stages. I can say this is more of a developmental growth. So what's the difference between a 2-year-old and 12-year-old and maybe 40 years old, 80 years old, how they think, how they actually behave, and how they feel. So 2-year-old may differ from a 12 years old and differ from an 80-year-old man. Okay, so that's developmental psychology. And lastly is the counseling and psychotherapy. So what's the difference? Counseling techniques and then counseling again. And then, what's the difference again between counseling and psychotherapy again? So basically, counseling techniques are those that I mentioned initially. Counseling and psychotherapy, we have techniques, we have different modalities. Like, I don't know if you have heard of it, like the very popular ones like CBT, cognitive behavioral therapy, and things like that. There are different modalities that you have to put into use and to apply, how you apply, and how you actually going to conduct the session with your clients. That's what you're going to learn in this counseling and psychotherapy, okay? And how you're going to apply it in different settings, right? So this is the fundamental that is in graduate diploma. So why graduate diploma? Why? I can give you 101 reasons why graduate diploma. Right, first, it's actually very focused. Like here it says focused curriculum. It's very straightforward. This is going to be counseling and psychotherapy. And it's 6 months, that's why it's really focused. So it's basically what you see is what you get. Okay, and also 6 months is considered quite a really fast track to complete the pursuit. Okay, and also one thing that is good that I think when I tell people why is it good for graduate diploma is that you can check your interest. If you are not in this industry, you want to maybe have a career switch, or you want to try to practice go further in this industry, you can check whether if you have interest and if this is your cup of tea. And it's conducted over like 4 weekend blocks. And basically, if you don't have any fundamental knowledge in this, graduate diploma is the one for you to check. And if you like to go further, of course, you can have the opportunity to go into this, later I'm going to share with you this Roehampton University, which is a very good school in UK. Okay, so that's one. And what's more, if you don't really like, you think that this is not your cup of tea. So after that you finish, you can also practice as one. It's not like a halfway through, okay, so I'm neither here nor there, and I cannot practice. Okay, you still have the skill set. Like I said just now earlier, skill set is for life. It follows you throughout your life. Okay? And another thing is, I think it's quite affordable for this. Okay, and also this graduate diploma is not as demanding as like you're going for a 4-year degree, that kind of thing. Okay, so, and of course so on and so forth lah. Okay, for graduate diploma was why this grad did. And then let's see, okay, let's look at the flow. So after you finish, so okay, let me talk about APACS a little bit more first. APACS, we have actually 5 levels. We have level 1, practitioner, level 2, practitioner, level 3, level 4, level 4S. So 1, 2, 3, 4, and 4S is supervisor. Okay, so basically the more experience you have, you will be at level 4. So level 1 is for people who complete 150 practicum, 150 hours face-to-face session practicum, and then you can go to level 1. But even before that, you can already join as student member. Okay, so let's say after this diploma in social psychology, you finish your practicum 150 hours, you go to level 1 and you can start practicing. Okay. So in between these, people are so I cannot start practicing. How do I actually achieve these 150 hours? So basically these 150 hours, that's what we call internship practicum, or rather placement practicum, where you do voluntary work. Okay, and source for the practicum it's social services and all that. They have this, they recruit interns to do their practicum work. And also, what's the difference between, oh, I want to be level 2 left. How about, can I straight jump to level 2? There's difference between level 1 and 2, because for level 1, you know that you're actually conducting or doing sessions that is at your level. You won't want to be level 1 and then you conduct a complicated case like what level 4 does. Okay, so that's one thing. And also because of the fee, okay, the higher, the more expensive. Joining association also helps you in professional indemnity in terms of insurance, okay, to cover yourself. So that is the track, okay, from level 1, 2, and up. If not, after you finish your graduate diploma and you think that it is your cup of tea, you really like it, you want to go further into this industry, you want to learn more in that, that's why I say you have the opportunity, because this is tied up with also Roehampton University. Okay, unless you have the correct, or rather you have the requirements, you can straight away go to this. But if not, if you start from fundamental, this is a good way to go into this. Okay, so Roehampton is really, really a good school. I'll tell you more about it. Here it is. Master of Arts in Integrative Counselling and Psychotherapy, which is only 2 years, but Master is, yeah, around there, 2 years or so, okay? And RU, Roehampton University, is one of the top universities in London. I think the top 12, okay? It's the top 12 university in London, and it has been around for like 176 years. Okay, you can go to their website and have a look. It's quite prestigious. Okay, so why the school? For Roehampton, they are being accredited by BACP in London, which is a British Association for Counselling and Psychotherapy. Okay, so program structure, 2 years. We have 11 modules here, and then you have to complete 200 hours of practicum over the 2 years. It's broken down, okay? And then 2 weekend blocks scheduled per month. So it's also weekend, like I said, Aventis, they curate the program especially for weekends, Saturday, Sunday, okay? So you have more time. These are the modules, have a look, okay? Introduction to counseling, the theory and the skills, foundations, and then there's 1 and 2 personal development. Now, the good thing is that in psychology, you not only learn that how you want to talk to people and how you want to guide people and things like that. It's about how you gain insight of yourself. During this journey, you know a lot more about yourself, which is a way that it should be, that you have to understand yourself and know yourself well before proceeding to help others, okay? So this is a really life, I can say it's a transformation if you're going into this course. The things you see, your perspective in life and the things, how you see things will be different, okay? So that's why a lot of personal development here as well, okay? And then your dissertation. Our graduates here, just to show you. So the very, very happy thing that, you know, when I heard about this is that the certification for this RU, it's from Roehampton itself, which means their award is from RU itself. There's no other schools, there's no Aventis on the certification, which means that your certification is solely from Roehampton University. Okay, so these are some of the admission criteria. You can check with it. You can check with Calvin more after this. The next intake for graduate diploma, it's May 30th, right? And for this one, it's only once a year, which is March next year. Okay, so after, let's say you finish your graduate diploma here, within 6 months, then just nice, you can go into the Master of Arts. Okay, let me see if you have any questions for now. Okay, so at the moment there are no questions. If you have more questions, you can actually take it offline with we take it offline with Calvin. Is that okay? Yeah. So Calvin, do you have anything more that you want to add?
Let's see, does anyone want to ask any questions about anything? Yeah, there's nothing in the chat. So
is there anything in the chat?
Maybe you want to give them a bit differences between counseling and psychotherapy, like how a psychotherapist can practice counseling and a counselor can't do psychotherapy.
Okay, so basically, counseling is when you target on more on specific issue. For example, like I say, I'm a counselor. Okay, you can come and see me in a session, and I target on what's your issue, maybe specific issue like grief, okay? Someone just passed on, and then you're feeling very sad, it's just the grief part that you want to share with me. And it's usually more short-term, like weeks and months, rather than psychotherapy, whereby you go really in-depth into what is the root, I can say what is the root of the problem that causes this person to feel like that or think like that or to act like that. And then it's more of a, it's usually, it takes years for psychotherapy. And for counselors, you cannot do psychotherapy work, but for psychotherapy, you can do counseling work. But of course, sometimes the psychotherapists, they use a little bit of counseling every now and then. So it's not a black and white, you come in for a session, I'll just use counseling method. It's not like that. So it's a combination. So it depends on which, what kind of program or what certification you are at. For most of the counselors, you have to look at their background, basically. So counselors, mainly speaking, it's more on a specific thing. You work on a specific issue. And then for psychotherapy, it's like, what's the root and what is it causing you to be like that, or your childhood, and then we start from there. So that's the difference between psychotherapists and counselors. Okay, if I answer your question.
Someone asked about Jungian modality. So that's a technical.
Jungian modality, yes, it's part, because his modality, it covers a few of the different psychologies. So a little bit of behavioral and a little bit here and there. So it is included. I remember teaching, I lecture this kind of modality. Okay.
Yeah. So someone asked, what is the first step to determine if we seek help for mental health? Do we see a counselor, a psychologist, psychiatrist, or psychotherapist? It's quite confusing for a layman.
Yeah,
it's quite
okay.
A big question over there.
Okay, that depends on that's them, right? Okay, that depends on your suitability, and it depends on your preference as well. For example, some people say that I don't want to divulge too much about my personal information. Maybe I'll just try a counselor first. And I think that maybe my problem is just, let's say, give you a brief one. I just want to work on my diet, okay? I just want to work on my diet. I think I'm getting fatter and fatter. I'll just see a counselor. Because that's a straightforward one. Okay, I don't want to divulge too much. And then psychiatrist is really more of a mental issue. Like you have the different kind of disorder. Maybe really major depressive disorder or personality disorder, or you're not sure if you are into that, you see a psychiatrist. Psychiatrists, actually, they are doctors, medical doctors. They prescribe medication. So you're thinking of taking medication to help you along, you see a psychiatrist. There are also patients seeing psychiatrists and psychologists at the same time. I have many clients doing that as well, concurrently. Psychologists are people like, I actually, like me, I do diagnostic assessment and things like that for people who doesn't want to take medication. And for psychologists, we can do counseling work, we can do psychotherapy work and things like that. Psychotherapies is something similar to counselor and also something similar to psychologist. So it depends on the person as well that you want to seek for help. And sometimes it's not about seeing a psychologist, counselor, psychiatrist, or whoever. It's that just this helping industry. And as long as you have the bond and rapport built, you trust that person, you feel that you're comfortable, then it's going to be a very good session. Okay.
So we have another one that says, does completing the master's in psychotherapy equate to the same level of competency as compared with being licensed in a psychotherapy skills taken outside, like CBT, CFBT?
CBT and SFBT, all these are actually the modality and techniques that you will learn in a psychotherapy, this kind of program, in this program. So licensed psychotherapy, I'm not quite sure what you mean by, because license is a very heavy, it's only used in in other countries. In Singapore, we don't call license, but we call certified. Either you call it certified or registered, because it's not quite regulated here in Singapore. So when you say license, it's like, oh, a licensed doctor. But of course, if you finish your course, you are a practitioner. So meaning that you are a certified practitioner, a certified psychotherapist, which means you can also use, or rather you have to use CBT, SFBT, and things like that. Okay, that's Jonathan.
I think the basis of CBT, SFBT is also covered in the graduate diploma, and we'll go deeper into the masters as well. Yeah. So, okay, we have another one that says, can you give examples of the root issues you are describing in psychotherapy? Because it can be manifested as specific issue too.
Because it can, yes. So the root issue, maybe if, okay, for some clients, they know that I have this specific issue, like, okay, I'm depressed. But this depressed feeling or this mood is only, I had it like maybe just 2 months ago. So before that, I wasn't like that. Okay, so this is specific issue. So right now, I have this specific issue of feeling depressed, and I go and look for a counselor. Okay, so I tell the counselor that I'm feeling depressed, but this is only for the 2 months ago. Don't know what's going on. Maybe I'm too stressed lately and things like that. If the counselor can help you in this, I mean, it's good. But after a few sessions, you think that it's still not working or it's still not progressing, then maybe it could be the root issue. So this root issue may be something that stems from childhood, that you have been suppressed for very long. And this one, even some of the clients, they don't know about this. They don't know if this is a root issue or this is something that is, just happened like that. So it is for them to actually, okay, so if the counselor is not able to help in this sense, usually what the counselor do or things like that is that they will refer you to another helping profession. So another helping professional, let's say, is a psychotherapy, and he or she will be able to find out, is it, they will do assessments and things like that. They'll find out, is this a root issue and things like that. Yeah. So root issues, we really don't know what it is. It could be something that's from a childhood. It could be something that, you've been traumatized by some incident in your life, like many years back. And yeah, so these are root issues.
Okay, so another one is, can you explain what is the pathway for one who is interested in becoming a certified psychotherapist and psychologist in Singapore? Is this certification recognized in other countries? Should I be keen to start a practice elsewhere?
Okay, certified psychotherapy. So after this grad dip, usually they can be a practitioner. So that's why I say after you finish your 150, you become a practitioner, and it's considered, with APACS, and you're considered certified psychotherapist by APACS. So that is certified psychotherapist, or we call it registered psychotherapist, and you can practice it in Singapore. For psychologists, you need to go through a stringent so-called exhausting master degree course for the psychology part, because psychology does a lot of evaluation, diagnostic assessment, and things like that. Okay, that's for psychology. And certification recognized in other countries. So if you go to other countries, you cannot just practice like that, but you have to follow the country, that particular country's law. So if, for example, if I want to practice, even as a psychologist and psychotherapist, if I want to go and practice in the UK, for example, I must have the recognition from the UK government, or rather the association from there, which in this case, if you are with RU, they have the BACP, you have to apply with them so that you can practice in that country. So it depends on that country. You cannot just practice anywhere. Yeah. But Singapore, I can say that it is recognized. Does Master of Arts support? Support your need, meaning?
Yeah, I don't understand the context of the question. What do you mean support your needs?
Master of Arts, you mean the Roehampton? Okay.
All right. So anyone has any other questions?
Oh yeah, I saw the one previously by Jason, just to check again if the classes are on weekends.
Oh yeah, definitely. All the classes we run cater towards working professionals, so we don't touch weekdays. We only do weekends. Especially people of slightly older generation. Whenever they go to class, you know, they don't want to do weekend. They don't want to do weekdays because, you know, exhausting from work. Firstly, physically, mentally. So when you come in on weekends, yes, weekends is precious to everybody, but weekends itself, you come in a fresh mind, so you're able to absorb. And for our postgraduate program, we also recommend students to actually do some self-study before you come to class, so you'll be more receptive of the things taught in class.
Okay, does training sites have to have a trained counselor or supervisor? Training site meaning the practicum, am I right?
Yeah, I think she's asking about the masters, because the masters, they have to clock in the 200 hours, right? Yeah, she just said yes.
Yes. There will be a supervisor with you, because each time when you go into a practicum, I mean, you get someone to so-called like, that means, okay, if you're doing a practicum, you cannot just go into a voluntary organization and say, hey, I want to do my practicum. So you have to have this confirmation, there's this acknowledgement as well, and also Roehampton there to acknowledge that you can work with this organization to do your practicum. Usually the practicum side will have to have a supervisor and a trained counselor or psychotherapist or psychologist there. This one,
So
as you go by, they will guide you. Yeah.
yeah, the minimum requirement for the on-site supervisor has to have, they have to be with a professional body. Secondly, they have to have a post-graduate qualification with minimum 3 years working experience. So they have to be registered as a supervisor as well. Then the organization and your supervisor, when you're in the master's program, you have to submit a form. Then you can, once it's approved, then you can take that site as your placement. All right, so anyone has any other questions? Okay. You mean upon graduation, upon completion of grad dip, am I able to practice in Singapore? I got that. Does this Masters of Arts from RU make me a certified psychologist, psychotherapist to practice in Singapore? Okay, like I think she explained the difference between psychologists and psychotherapists already. So this one is not towards being a psychologist. This one is towards psychotherapists and counselors.
Hi, I'd just like to ask a question. With regards to this course, because you're quite counseling and psychotherapy, right? But I seeing the courses that's being taught, they do have focus on CBT and psychodynamic features and all that. How is this different from other courses they just call it Masters in Counselling? Because they also do cover like CBT techniques as well inside the program. So like, can they, if you complete from there, and as long as they register with the APACS, can they also then become a psychotherapist, or is this something that only you can do it through this master's program?
Okay, so in the modules, right, what you're talking about the postgrad dip or the RU?
The Masters of Psychotherapy and Counselling.
Okay, the Roehampton University one.
Yes.
Okay, so for this one, right, you're asking about CBT and, you know, SFBT and things like that. There will be a lot more covered. It's not just CBT and things like that. These are all modalities. Don't worry about the modality side, because that is the techniques and rather the things that you need to use as a psychotherapist. Okay, so I think the question you're asking is about, after this, are you going to be a certified psychotherapist? Am I right?
Yes, like basically, is there a difference between this and maybe a person who does just a master's in counseling, but it covers the similar topics, then they can apply under APACS, right? From what I understand, that's the body for psychotherapists in Singapore.
Yeah, usually as long as you have this certification of psychotherapy and counseling, and then you apply yourself. I mean, you do the application with APACS. Then, as a practitioner, you are considered actually certified, or rather we call it registered psychotherapist, or registered or certified practitioner. The good thing here is about the school, one thing, and then also the more in-depth.
Okay, Ken, thank you.
Okay, anyone has any other questions?
Okay, any more question about APACS? I can say this one is like a very good package lah. It's really a very good package because it's already accredited with APACS. So when you're signing up and doing your application for APACS, I mean, it is already there. We know that this is being accredited already, things like that. So
yeah, maybe you want to go to that slide, then you can, you know, the level 1, level 2 one. So you can go to this slide and then just brief. I think because some people just came in and all that, so you can just explain real quick about this. Yeah.
So for APACS, we have the different categories for membership. We have student membership, we have original membership. Okay, we all start from original membership. You don't even need to be a certified practitioner to join APACS. Let's say if I'm just a layman, I'm very interested in psychotherapy and counseling. So I just want to know what's going on in this industry, how, you know, what is it like, and then the events and, you know, some voluntary works and things like that. I can join as an ordinary member. Okay, so as an ordinary member, you don't have to do anything, you don't practice and things like that. And after that follows by level 1, or rather, okay, for those students, they are student members. So as student members, they enjoy, of course, at a lower fee and what's going on and things like that. Okay. After that, level 1, you finish your grad dip, you go to level 1 because you have 150 hours of practicum done, and you go to level 1. Then you can start practicing, and you can call yourself a practitioner, or you can call yourself a counselor, or you can call yourself a psychotherapist. Okay, that's level 1. Even for level 2, level 3, it's all the same. You call yourself a practitioner already. You are already practicing. The differences between level 1, 2, 3, and 4 is just the experience. Okay, any question about this? And of course, to practice in Singapore, it's better for you to have this a backup from the board, which is this kind of associations. Also with your insurance, like, you know, the medical doctors, they have this insurance, professional indemnity. So even for counselors and psychotherapists like us, we will also need this kind. What if your client sue you in that sense? You don't use your personal insurance to claim and things like that. Okay. And for Singapore, it's APACS. For the UK, it's the BACP. For the master course, it's also moving towards accreditation by SAC. Okay, so the accreditation here is by APACS, but not SAC for the counseling component. Of course, you register yourself as a, okay, accreditation itself is from APACS, but if you want to join SAC as a member, you can do so as well. It's not that your accreditation is from APACS and you cannot join SAC. We have members from both SAC and APACS as well. So what's the difference between APACS and SAC? I've actually answered 1,000 times. Okay, APACS stands for Association of Psychotherapists and Counsellors, Singapore. Okay, SAC, Singapore Association of Counsellors. So SAC mainly the members there are counsellors. So for APACS is a very holistic approach. So it's counsellors, psychotherapists, and everyone in the I mean, whoever, I told you, they are nurses, they are teachers, even engineers, they just got a certification for probably like, let's say CBT, and they just join APACS. It's more of like very holistic allied healthcare professional. But for SAC, it's mainly counselors. Yeah. There are also psychotherapists as well. Just that also one thing, the difference is that I think SAC, the, what's that called? Requirement for entry, it's quite rather, there are quite 600 hours to complete. Yeah. The entry
Yeah, they have 600 hours to do a registration with them. So that's why we actually go for APACS accreditation. So you actually have a step-by-step instead of, going for SAC one. So even if you don't complete 600 hours with them, you can't be with the organization. So we do a more step-by-step.
Yeah. Although APACS is like not so, you're looking at it like compared to SAC, it's not so stringent, doesn't mean that it's not good, because we are not like, same cop, everything, everyone will take in, okay? But we work towards the direction whereby we give people the opportunity, like let's say people with diploma, and they want to go into this field, but they are not yet a degree holder in this field. So in between, they really don't know where to go, but they want to help. In this case, APACS also provides some courses, bridging courses for people to take to go to level 1 before they continue with their degree outside and continue their journey. So it's really step by step. Okay.
Okay, does anyone has any other last questions? Okay, then I think you can go on to the slide where they got my contact over there. I can just leave it there for.
Okay. Yeah.
All right. So if anyone has any other questions about the program, the masters or the grad dip, my name and number as well as email address is over there. So anything, you can just give me a call or WhatsApp. After this, I would send you all the maybe the slides, something, so you can take a look and have a clearer picture. So if anything, you can just give me a call. So anyways, Jeslyn, thank you very much for this afternoon. Right.
Okay,
Thank you very much.
See you soon. Bye.